Hi, and welcome to this month's episode of The Waiting Room. I'm Al Roberts, Managing Director of the Almonte General Hospital, Fairview Manor Foundation, and today we're going to talk to Maureen McLeod Fraser, who's the manager of our emergency department. Hi, I'm here today with Maureen McLeod Fraser, who's the manager of the emergency department here at the Almonte General Hospital. And Maureen, you were telling me about this new central monitoring system. When did we get this?
So we got this about a year ago. It brings the tracing from the ECG monitor that's in the room onto this central station. That way we have the ability to monitor 3 patients out in this room. So as we get busy in the other rooms, if there's somebody here, it alarms here, we can see what exactly is going on with that heart, and somebody's usually here. Either a nurse is doing orders or a physician is writing up their chart, so there's somebody in this central station. So the benefit is that we actually see it here, rather than the patient way back in there will alarm, but we have to walk there to see what's going on. This way we can see it right away, we can react to it right away, and that's the benefit of it.
So just for the uninitiated, ECG, what does that stand for?
So that stands electrocardiogram, and that's the tracing that your heart pumps. There's electrical conduction that causes where you see the big beats like that up and down. That's your heart's beat, and we see that on this monitor as an electrical tracing. And so that's what we're seeing right minute by minute, exactly what the heart's doing, how it's functioning properly or not.
So in terms of someone would come in and they feel like they have some sort of cardiac episode happening, just walk us through what would happen then.
So if a patient came in with chest pain, we would, depending on what they look like, so they could be very sick or they could not be as sick, we would do a manual ECG, which is on a machine. Then we would place them in one of the rooms and we would put them on the monitor and do their vitals there. We would also see it here.
Okay.
Yeah.
So I mean, this allows the nurses to kind of keep an eye, and the doctors to keep an eye on what's happening, but they don't have to be in the room with the patient all the time.
That's right.
Yeah. And so this was as a result of donor dollars that we were able to acquire this. Mm-hmm. So from your point of view, this is the kind of technology that donors are helping the ER to get?
Absolutely. Yeah. This is really, really beneficial because we still do have only 2 nurses on, 1 doctor on. So with the amount of patients that we have in the department on these days, we're getting busier and busier. It gives us that availability to see it right away.
Fantastic. People are often surprised, Maureen. We're doing over 17,000 patient visits a year here in the emergency department.
Yeah, it's very busy.
Yeah. Thanks a lot.
You're welcome.